We're at Maze Health in Purchase, New York. Dr. Michael Warner, he's the medical director. He's also my personal doctor. This is concierge medicine. They handle everything for me. Day-to-day life, my TRT, fertility. Today, we're gonna be doing a quarterly review. I just had my labs done, and we're sitting down with nurse practitioner Nick Cannon and just talk about my life, what I've been going through. We've been going through IVF. I got back on TRT now. So we're just gonna really touch base and kind of like get a plan going forward. I also wanna look over my labs. I also wanna talk about all my medications that I'm taking and all my supplementation, because these guys manage everything for me. So join with me as we sit down with Nick Cannon and we just talk about TRT in general, my life, my medication, and my supplementation. So we're here for my quarterly review. I'm with Dr. Nick Cannon, nurse practitioner, and Nick is the man here at Maze Health Clinic. Like, he's the person. I love Dr. Warner, but I'm always so happy to see you and talk to you.
Well, I'm grateful, thank you.
So we're gonna go through our quarterly review. I've been on TRT now since I think 2021. I looked through my emails from when we first started a relationship. I came to Maze because they are by far and away the best in Westchester. They're also in New York.
Yes.
They're in Long Island, I believe.
Not Long Island anymore.
Not Long Island anymore. So they're in New York and they're Westchester. And these are the top guys in this area. So if you can drive to this location, you can drive to New York. I recommend them not only because of their knowledge of TRT, not only because of their knowledge of fertility, which in some ways, especially if you get on TRT, go hand in hand. They also, the lipids, the understanding of cholesterol, which #1 cause of death is heart disease. So having someone that really understands cholesterol, massive. And then the other thing is these guys, they're concierge service. I mean, I send Nick a message. He responds to me either Monday, first thing in the morning, or the next day, and they help me out with a ton of stuff. So today we're just gonna be talking about my general health and kind of where I've been going. And Nick, we can talk about anything today. You can talk about how I've been going through IVF, about the half dose, open up anything and just talk.
Yeah, so I think the way that we should start this is sort of, so the journey for fertility was an undertaking, to say the least, for you.
6 months.
So obviously, one of the important things to understand is that when you're on exogenous TRT, you're gonna be impacting your sperm production, right? And so we deal with a lot of men who are on TRT and they want to engage in the fertility process. And we need to maximize sperm production at that time. So everybody's different. So I think that's the first thing to sort of put out there, is that not everybody responds.
Yeah, you said you had guys on 200 milligrams.
Yeah, so I mean, we have patients who just run TRT, pretty good dosages of it, and they'll get their girlfriends or wives pregnant, right? And then we have guys on very low dosages of TRT who completely shut down sperm production, right? And then you have everybody in between. So you have to know there's a genetic component to that, right? For you were on, your usual dosage of TRT, which we were running, which was
200 milligrams.
200 milligrams a week.
Two injections. These guys love subcutaneous. I still old school. I still do intramuscular. And I do it every 3.5 days. So I do it Monday morning and Thursday afternoon when I don't to work.
Correct. And again, either way works, right? We know absorption is quite good either way. When we go down the road of fertility, obviously, there are multiple different avenues you can go through. One of the things we know for most guys when they're on TRT is, if we take the TRT off, we should get that recovery back, but then the patient doesn't feel as good, right?
I felt like I cut my dose only in half, and I felt like shit.
So
so tired.
Right. So what we try to do is we try to add on some things that are going to stimulate the testes to get active again, which usually HCG and or Clomid and Clomiphene as ways to do it. I find the HCG works quite well. We'll even have patients run a low dose of HCG while they're on test to sort of keep things going. In your case, we added on the HCG. That keeps the intratesticular testosterone going at that point, try to get things going. And then what we saw is over a period of time, as we whittled down the dose of testosterone a little bit, again, you never came completely off. Got to the half dose, so basically 100 milligrams a week. We were able to get sperm production back, and we were able to cryopreserve or freeze that sperm for you. So
we went from 2,000,
2,000 total motile count, so motile sperm in the ejaculate.
2,000 to, I think my best load was like 40 million. 40 million, so from 2,000 to 40 million, which just speaks, I mean, these guys are fertility first, I believe that's
Dr. Warner is a urologist, but he's fellowship trained in infertility and sexual dysfunction. So that's an extra specialty that some urologists go through.
So you guys are for their fertility first, and then their hormone replacement,
absolutely.
and obviously all basic medical needs as well.
Correct.
You guys have been amazing. But they got my sperm from 2,000 to 40 million. So we went from everybody saying, "Oh, you'll never be able to have a baby naturally," to, "Oh, you could have a baby." We moved the process along because my sister Chelsea has Angelman syndrome, which is a form of Down syndrome. And also just because we're getting up there in age, so we just were like, let's, we got approved through insurance, so we said, let's go straight to
IVF route, right.
So my girlfriend thinks it'll be better with boys than daughters.
So we have bank sperm now for you, which we went through good amounts of that.
Like 100 million thawed, once it's thawed sperm.
Yes,
good.
So at this point then, I spoke to Jacob a couple weeks ago, and we decided that once we got the sperm cryopreserved, we would move the dose back up on the testosterone.
Back.
So at this point, you're doing the 200 milligrams a week.
Yeah. Can I kind of walk you through everything I'm doing?
Exactly.
Okay, because there's a lot. So I just want to go through all supplementation and stuff like that. So the first thing I'm doing is I'm taking 200 milligrams of testosterone, and I take it twice a week, Monday morning. And mind you, it's 100 milligrams twice a week.
It's a half a cc.
It's a half a cc twice a week. It's Monday morning, and then it's Thursday afternoon. And that just works for me with my career, and I do exactly half break up the dose.
Right.
Every Monday right now, I'm taking 100 milligrams of nanodrolin, and that is prescribed. I have some past shoulder stuff that's been acting up on me a little bit, so I wanted something to help with the collagen, so I talked to you about that.
Yep.
So that I am taking as well.
100 milligrams once a week.
Once a week. And then to go over all the other stuff. So I'm off HCG now. I'm off endoclomin now.
And clomiphene.
Yep. And now I think just starting with prescriptions, I just switched the AB.
The telmisartan.
Yes. Pronounce it for me?
Telmisartan.
Telmisartan.
Yep. So it's an angiotensin receptor blocker. Helps control blood pressure.
So it helps control blood pressure. I was also interested in it because it has protective factors, kidneys, and I believe also some heart protective factors as well. So that's why I wanted that. Even if I didn't have high blood pressure, I was interested in it because I'm kind of at that point where I'm kind of dabbling in kind of like learning the stuff I can do to protect myself for the future.
Right.
So I'm taking that as well now. Then I'm taking metformin.
500 milligrams?
500 milligrams. The same reason. I don't have any glucose issues. I believe it's also protective of liver.
Correct. So, I think the issue with the metformin, there's been a lot of data that's come out in terms of the longevity aspect.
Yeah.
Metformin can potentially help with longevity.
Yeah.
Again, there's a bunch of studies. There's a major study going on at Einstein, which should have some data really soon.
Awesome.
Promoting that. Again, I think the metformin piece, I don't use metformin myself, but definitely will prescribe it to certain patients if they're looking for sort of longevity purposes.
That's why.
Yeah.
That's
so
why
it'll
both the blood pressure and that.
And again, the metformin, we've just started the metformin not too long ago. So again, want to make sure that liver function is good on it. See how everything sort of goes.
Right. And some people have nausea issues. I have a stomach like a cast iron. My dad used to say I would eat anything that didn't eat me first.
Right.
And then I haven't had no lactic buildup from it. And some people I know get crazy lactic from it. So those are and then I take 2.5 milligrams of minoxidil, which I don't take for blood pressure.
That's the hair, right?
Yeah, I'm probably gonna have to get a hair transplant at some point. I'm looking at this thing, not winning. I'm beating it. I'm throwing it down.
You won't win. If you're genetically predispositioned, you're never going to win.
Even with finasteride in itself, I'm still not winning. So that's minoxidil, and I think that's all the prescriptions I'm taking. I mean, quote unquote prescriptions.
And supplement-wise?
Supplement, I take 2 grams of the icosapent, which is EPA a day. I take 2, even though I'm prescribed 4. I take 2.
That's fine.
And then I also take 1 gram of DHA.
Okay. So again, just so people can understand, so the EPA-only fish oil, brand name Vasipa, has been shown in clinical trials to reduce cardiovascular risk, right? The only sort of FDA approved fish oil that's shown that, right? Loveza, which is a DHA only fish oil, never had that data. Will reduce triglycerides, but not do that. I like the combination of the EPA and the DHA. I think that gets that, but the EPA is really the best for that. So that's quite.
And the other thing is that I've always kind of tipped the line with cholesterol, with lipids, and fish oil does improve cholesterol, but it can also
mostly the triglycerides and HDLs and things like that.
Exactly. It can also raise LDL as well as raising HDL. So that's why I'm only taking, actually it totals up to 3 grams with the
DHA.
So I
top
get
of the
3 grams of EPA and 1 gram of DHA. Again, I said I've kind of fallen into that weird category. I'm taking a lot of pills for longevity at this point. But that's why I'm checking with you. I want to see my rationales correct on them. So that gets us to fish oil. Next, we're at magnesium. I take 500 milligrams of magnesium glycinate a day. It tastes like shit, so I take it in capsule form. So I take the powder. It tastes like it's horrific. I take 10,000 IUs of vitamin D, and that's through our work together that we found.
We found that right dose.
Right. Same thing is true with the DHA. I take the same thing. I take 25 milligrams every other day. That got me not into super physiological levels, because any of the stuff that I'm taking, I'm trying to be in a normal, optimal range. I'm not trying to have like, I'm not trying to be like on performance enhancing drugs. I'm trying to maintain health.
And when you first came in, the DHA levels were super physiologic.
They were low. They were low originally.
And then we put you on the dose, and then it went high. And now we've sort of found the right dose.
Exactly. And that's what you should be doing with supplements is if you need them, take them, and then find the right dose. So that's DHEA. And then let's get into some of the weirder stuff. Rhodiola, I'm still taking, which is an herb. I am taking KSM 66, which is just an abstract of ashwagandha. And I really think that's it. That's it. That's all the stuff I'm taking.
Any Adderall at this point?
Also, too, I take 200 milligrams of L-carnitine subcutaneously injected. And that's an amino acid. And the reason I just simply take it, it helps with fat loss. So I'm taking that as well.
All right. So again, when we do the blood work, we look at testosterone, we look at estrogen. Obviously, that ratio is significantly important. We look at DHEA levels. We look at the free androgen index levels as well, right? So want to know sort of how much of the testosterone is bioavailable. We look at glucose, both from a hemoglobin A1C and a fasting glucose level. We look at liver enzymes. We look at kidney function. We look at lipids. Lipids, we include a total cholesterol, a triglyceride, an LDL,
alpha lipoprotein,
and an ApoB level, which is really the most important one that we're following, because that really is going to dictate sort of how many of those particles are circulating through.
LDL as much of a concern as people think it is.
It is,
still the data is still pointing in that direction, right?
And it's still in any of the guidelines that you look at, especially in this country, LDL is what they're going to look at. LDL lipoprotein. Again, that's looking at the concentration of cholesterol carried in that particle. We like to look at apolipoprotein B, which is looking at the integrity and see how many of those particles are there. So that's what we follow. We also obviously follow CBC. Obviously, one of the things we always want to monitor for testosterone is the red blood cell production, making sure that we're not getting, any polycythemia, that risk for blood clot, things like that.
And so I get my labs done here quarterly, really on top of everything. And these guys are very on top of it. But really the reason why I get my labs done quarterly, one, because I'm on TRT, but also two, just because it's the best predictor and preventer of disease.
Correct. So again, the MAG is great, offers a lot of benefits from multiple different things. Actually, it's very good for relaxation and
the magnesium
and sleep. So guys like that.
I've heard so much stuff about pancreatic cancer, the risk reducing from it.
I mean, there's I don't know enough data on that to promote that. I promote it for other things. But again, a lot of times with these vitamins and supplements, obviously we never want to create medical issues with supplements that you're taking. So again, it's making sure that there's safety in everything that we're doing. And longevity is extremely important to us. That's why we really promote heart health, lipid health, because cardiovascular disease is something that we have some control over. Again, from your perspective, the weightlifting, the training, you know, that puts the heart at extra strain as well. Want to prevent any left ventricular hypertrophy, things like that.
Yeah.
So again, there's multiple reasons to you know, be aware, monitor, and keep everything sort of normalized.
Yeah, there's three major reasons I come here. Is one, health, longevity. Two, I love working out. I wanted to be able to do it at a high level. And three is the fertility. And you know, you guys have been talking to me since I came in and saying eventually.
Yes, eventually, right, exactly.
Yeah, exactly. And so all three of those reasons is why I come here. And regardless if you're in this area, this is where you should be coming. Especially if you're dealing with fertility or you're dealing with want to do hormone replacement therapy. But regardless, if you're making some decisions about supplementation, and especially medical level supplementation like testosterone, you need to do it under the guise of medical supervision.
Yes, absolutely, absolutely.
Awesome.
Great.
Dude, thank you for your time, sir.
Yeah, man, my pleasure.
For sure.
Always.